Hey guys, Kevin here from Crowncraft. Today I wanted to do another reaction video, this time to Nutrafol, which is a hair supplement, hair regrowth supplement that I came across. Just for full disclosure up front, I have no relation whatsoever to this company. I'm not paid by them to promote their product, nor am I being paid by a competitor to do a hit piece. This is just me reacting to their claims and kind of doing a little breakdown of what they're all about. For your information, I am a pharmacist, so I'll be critiquing that from that perspective and kind of diving a little bit into the science. Without further ado, let's get into it. So it seems like overall, in case you weren't familiar with this to begin with, they're a 100% drug-free formulation that's clinically proven to promote daily hair growth and helps men experiencing hair thinning grow visibly thicker and fuller hair. So that's a pretty strong claim. Looking into it a little bit further, it is expensive, I would say, at $80 a month for a 1 month supply. And they do have quite a few things that come with your subscription. So they have this result in 6 months or your money back guarantee. There are some caveats to this guarantee that we'll touch upon a little bit later in the video. And it also comes with wellness coaching from a naturopathic doctor. That's pretty interesting. Could be a valuable add-on, but I think my personal opinion is naturopathic doctors, like any other doctor or healthcare professional, there is a wide variety of competency and quality to what they can help you with and how good they are as practitioners. So this, I don't really know whether they're good or not. That's going to be up to you to decide and up to the individual practitioner that you get paired with. And then they also offer this hair mineral analysis. And this is actually a pretty interesting thing that most people don't know about. A hair mineral analysis essentially is you cut a little bit of your hair and you send it off to a lab, and they do analysis of what sort of minerals are present in that hair, and that can give you a little snapshot in time of how many nutrients you're taking in and what's making it through your body and into your hair. And that can tell you a lot about your hair health and also your health overall. But the interpretation of hair mineral analyses are not set in stone. So there's a bit of an art and a science to doing that, as with most medicine. Take that for what you will, but I think that this is a legitimately cool thing that they're offering. And then also Headspace, which is a meditation app. That's nice. I do like that. And stress can affect your hair loss. Looking at all these things that they're bundling in, you can look at this two ways. One is, hey, they're trying to justify this pretty high price, so they're putting a bunch of add-ons to that so that you feel like you're getting a lot for your money's worth, and that's a good thing. Or you can think of it as maybe their hair supplement isn't that great and they're trying to like bundle enough so that you think it's worth it to you. I'll leave that up to your own interpretation. You know, they have some pretty crazy claims, like, look at this, like 84% of men saw improvement in their hair after 6 months. And that's linked to a study that we'll dive into. And the main benefit that they're pushing, besides the fact that there's improved hair growth and hair volume and all these like nice things, that it's essentially does not affect sexual performance, which is a legitimate concern with finasteride, which is the most commonly used hair product right next to minoxidil. That's their claim, is like it's a lower side effect or side effect free way to improve your hair growth. Let's kind of go a little closer or look at this a little closer. There's some pretty nice before and after photos. It does look pretty appealing. I'll give you that. So into the science, which is the clinical studies. So they make some pretty strong claims. They say we literally count hairs. So they do a combination of industry-leading hair measurement tools, from hair counts to pull tests to assess growth, quality, shedding, and textures. Because our results aren't just visible, they're measurable. Keep this in mind. And they say we also publish our results in scientific journals, and it undergoes evaluation by scientific experts. both of these things sound really great. If I take this at face value, this sounds excellent. All right, so over here, we have their first major claim. Nutrafol Men is clinically proven to improve hair growth and hair quality. This is 84% experienced improved hair quality, and 72% saw improvements to their scalp coverage. And they reference this trial here, this Stevens trial in 2022. And then here they even say we track the improvements, and they say compared to placebo percent of subjects, more men had improved hair growth at 180 days compared to the placebo group. And these results were progressive. So you see a smaller difference at day 90 and a greater difference at day 180. So all of this sounds really great. And they have this study here in 2025. Let's dive into the studies, because I think that will inform quite a bit about, how legit are these results. Enjoying the video so far? Well, please hit subscribe. It's the most evidence-based way to keep the hair on my head from falling out. Thank you. All right, so let's get into the first study. So I'm not going to do a super deep dive of it, but I will talk about a few things that jumped out to me as potentially very suspect or problematic about it. So a brief overview. It's a 6-month single-blind study evaluating changes in hair growth and quality using a nutraceutical supplement, in this case Nutrafol, in men and women of diverse ethnic. So they enrolled about 47 men and 51 women, and they reported that they, after taking this supplement as directed, that they saw significant improvements were seen in 83.7% of men and 79.5% of women at week 24, 6 months. So it sounds great, but if you look a little bit deeper, there's going to be problems, as you'll soon see. First of all, they call it a single blind study. In case you didn't know, a single blind study is a study where the researchers or the investigators, they know who is getting a placebo pill, a sugar pill, and who is getting the actual studied drug, or in this case, the studied supplement. But the patients don't know. This is important to have a placebo-controlled group because the placebo effect is very strong in hair loss studies. So the placebo effect is you perceiving a benefit or an effect from a intervention or a drug that doesn't actually exist. Meaning, like, I give you a sugar pill for 6 months and you thought that your hair improved, when in reality that was just you thinking that it did. It wasn't the medication. Maybe your hair did actually get better, but it wasn't from the medication, right? Because you weren't actually taking something. But you can see that in larger hair loss trials. A lot of men in the placebo group, and it's not a small percentage, not like 1 or 2%, it's actually fairly large depending on the study, they will report a benefit or change in their hair loss after like 6 months or so. And that can really throw the results off. Is it actually the medication or supplement improving your hair loss? Is it responsible? Or is it just like, natural fluctuations in hair count that happen to everyone throughout the year? This is a normal thing. It could be hair loss that spontaneously recovers because you had a little bit of shedding because you were super stressed out for a period of time, or you were ill with like a severe illness for a month and you had some hair loss and it just naturally recovered and had nothing to do with the medication. But you can't actually determine these things without a placebo group, right? One of those disorders is called telogen effluvium. You can kind of do your own research and look that up, but that's actually a very common disorder in a lot of people with hair loss. So a big problem with this study is that there was no placebo group. Everyone got the supplement. No one was tested with a sugar pill. So you actually can't tell whether or not this pill was responsible for the benefit, or was it just people having natural fluctuations in their hair and perceiving a benefit. That brings us to our second point. There was no objective study of hair regrowth. You can see what I mean when you look at the procedure of this trial. How did they actually run this study? So patient would come in for 3 clinic visits. at baseline, week 12, and week 24. They also did a self-assessment at week 4 and week 8. So they had a picture of their hair taken by a camera, and then there was an investigator that rated the images for overall treatment benefit. And they looked at growth, coverage, density, and volume using this scale, basically a subjective scale compared to baseline. So all this jargon means that they didn't actually use any method that counted the number of hairs on someone's head, something you could legitimately measure. They only looked at what did some guy think about, how your hair did. So it's entirely subjective. This is open to so much bias, right? Another thing you need to know is essentially like 4 out of the 5 authors on this study were employees of this supplement company. So you can kind of think there's a lot of conflict of interest here to report good results. So when you have a subjective scale, anyone can say, yeah, that looks better. And then that's counted here. We don't actually have any photos to look at to see how well the patients actually did. You just kind of have to, trust me, bro. That's what this whole study is going off of. And these photos are like very nice and rather impressive for a supplement. I'll give it that. But this could be totally cherry picked. What if this guy would have done just fine without this supplement? You can't actually say that, right? Hair can change over time. Like so many things could be at play here that causes this change. It's really, really hard to say. I think this is like a kind of a smoking gun here. Here, this self-assessment questionnaire. So they asked the patients themselves, do you think your hair improved? They state all subjects reported significant improvements in baseline appearance, quality, volume, fullness, and coverage of the scalp, thickness, and shedding at weeks 4, 8, 12, and 24. If you understand how the timeline of hair regrowth works, this is probably BS, because at 4 to 8 weeks is generally too soon to see any benefits in your hair. Hair regrowth takes a couple of months at the soonest. Good quality hair studies start looking at results in like 4 to 6 months is the first time you can tell like whether or not your hair is actually regrowing or not. So the fact that many patients perceived a benefit at week 4 implies that there's a very strong placebo effect at play. One cool thing is that for safety events, there was no unanticipated adverse events and no serious treatment emergent adverse events. One guy said he had diarrhea. So it seems like the supplement is well tolerated, which is a very good thing. That's a plus for them. And they do mention that one of the limitations of the study here is that this included only subjective assessments for hair growth and quality. Another thing that is not great is they say that this is an open label study design, meaning that the investigators and the patients all knew exactly what they were taking. So that kind of contradicts what it says here, which states that this is a single blinded study. So which is it? Why would you put that here if this is actually open label? I don't really understand this. Maybe I'm misinterpreting the study somewhere, but this is a major critique as well. I also mentioned briefly earlier that all of these study authors are employed by Nutrafol, which is a clear conflict of interest. I think one of the members here is actually employed by the research organization that they paid to run the study, which is not unusual, but there's a lot of problems with that. When you're running a study, there's no neutral party, right, to kind of give more unbiased results, right? So the takeaway here is this study was entirely subjective, could have a lot of biases. There was no placebo-controlled trial or placebo-controlled group, so you don't really know what was doing what. And the subjective scale is simply that, subjective. It's hard to kind of gather what's really happening here when you just ask people do you think your hair got better? And they're like, yeah, it seemed like it did. That's not the sort of rigor that I would like to see in a trial. But let's take a look at another study that is a little bit better that they also ran. All right, so this is the other study that they referenced in the website. This is a much stronger study than the other study because it's actually a randomized, double-blind, placebo-controlled study to evaluate the safety and efficacy of a nutraceutical supplement, blah, 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 blah. So double-blind means that the patients don't know what they're taking. The investigators don't know what the patients are taking, meaning that they don't know who's getting the placebo pill or the actual supplement. This is really good because now you're just kind of going into it with more unbiased interpretation of the results, which is very, very important. Your kind of preconceptions about something working or not working can really change how you interpret certain things. So it's key and great that they did this. The classification of subjects were also much, much better. They looked at men between the ages of 21 and 55, and they classified their hair loss based on the Norwood scale by a dermatologist. So this is way better criteria than just people having perceived mild to moderate hair loss, whatever that means, in the other study. So this is already much, much more robust. And just a brief breakdown of the study, essentially they enrolled a bunch of men in a 2-to-1 active versus placebo ratio. So 2/3 of the men enrolled were given the supplement, and then 1/3 were given a placebo pill. No one knew which, like I said, is great. Then they had 3 clinic visits at a baseline at day 90 and then day 180. And they got a physical exam. They had global photographs taken of their hair. They had a hair pull test, and they did some questionnaires. And they say here that 2-dimensional standardized global photographs were obtained using IntelliStudio standardized global photography. This was a more objective measurement of how many hairs were on your scalp. However, there's a big problem with this study, and they even state that here. The original endpoint of this 6-month study was the change in mean terminal hair counts at day 180 using the Canfield Hair Metrics non-invasive device, meaning that they intended on counting hair counts at day 180 versus the baseline. This is a super high quality objective measurement. However, during clinical site monitoring, numerous protocol deviations specifically rated to the Canfield Hair Matrix occurred at one site, rendering many photographs basically unusable for analyses, and they essentially threw out that entire endpoint. The most valuable and most objective endpoint was disregarded by the study. So then they fell back to essentially subjective measurements and surveys of patients' improvement in hair, just like the other study. So this calls into question this objective measurement. This whole point of the study was basically mucked, and they threw it out. And then they went with the subjective thing. Now, was it actually protocol deviations that led to the primary endpoint being removed from analysis? Was there other things happening behind the scenes that we don't know about? I can't say, but this really does greatly lower the validity of these results or the robustness of the study now, because you're falling back into subjective measurements, which is open to bias and interpretation. I mean, it is better because this is a blinded and placebo-controlled trial, so it's much better than the other study. But still, now you're kind of running things based off of vibes once again. Looking at the results, it does seem pretty positive for the Nutrafol group, right? More patients on the active study drug, their supplement, showed that they had an improvement, right, compared to placebo group. But you also can see like about 50% of the placebo patients had perceived benefit, right? Half of the people on a sugar pill said that they saw improvements in their hair. More patients in the study group showed a benefit, but how big is this gap really in a small study like this? It's hard to say. And once again, these photos could be cherry-picked, hard to tell. You know, you're not looking at every single photo, just like the nice ones. That's what they're going to publish. One good benefit is that this Arizona sexual experience scale, looking at sexual dysfunction in men, they did not see any significant changes in responses in either the treatment group or the placebo group, which is very promising and very good. So it does not seem like this supplement affects your sexual function. And essentially that's kind of the takeaway here is potentially this active treatment group might have some modest subjective improvement in their hair according to the validated questionnaire. What I find interesting is that for the self-assessment questionnaires that the patients took themselves, they showed improvements throughout the study on some hair parameters, but the differences compared to placebo were not statistically significant. So even amongst patients who were on treatment versus placebo, there did not seem to be a statistical difference between patients who are taking the placebo pill and the treatment pill having perceived benefit. So this is unclear. Also, another thing that I wanted to draw attention to is that the placebo group had a greater portion of men who had much more severe hair loss, right? 40% of men had Norwood 4 male pattern hair loss versus only 23% in the Nutrafol treatment group. This could be just based on due to how the groups got randomly assigned, but it could kind of skew the results. If you could just think like, hey, if I'm in the placebo group and I am a Norwood 4 and I lose 200 hairs over the 6-month period, that's going to be a much more drastic subjective worsening than someone who is Norwood 2 losing 200 hairs. You're less likely to notice that. So it can kind of like widen that gap between the treatment group and the placebo group and maybe make their treatment seem more beneficial than it actually is, right? These study groups were not as equally distributed as you would have liked to see for a fair comparison. But overall, this is a much better study than the other study that we looked at. It's placebo-controlled, it's blinded. They did try to do an objective measurement, and that they did have greater robust quality of this study. They actually used dermatologists to like rank people's hair loss and break that down. So, this is not terrible. Take it with a grain of salt. So coming back to the website, after looking at those two studies, I don't know where this comes from. We literally count hairs. I think they did in the women's studies, but they sure did not in the 2 men's studies that we looked at. Maybe there is another study where they did. I didn't see it, at least from these 2 that they reference in their claims right here, right? This claim here and this claim here. They did not count hairs. That's just simply a fact. So a lot of these numbers and nice positive results are a bit more subjective than you would think after running through those things. And then I wanted to close out with like two other little things. So going back to the Nutrafol for Men product, the supplement label, right? Over here, they talk about what are these components within the actual supplement itself. Will this actually work? Two issues that I can see off rip. First of all, they mention this Synergen complex and this Nutrafol blend, and they give this nice number, 1.472 grams. But they don't actually tell you how much of each individual component makes up this blend. You don't actually know. So this could be a way to pad the ingredients list and say, like, look at all the things that we include in the supplement. But maybe it's only a tiny sprinkling of that, and it's not actually enough to actually have a benefit. Like, for example, saw palmetto actually might have some benefit in hair loss. It's probably the most robust ingredient on this entire list for doing that. It can be a mild DHT blocker. It works similarly to finasteride, but it's very weak. Finasteride's much stronger, and it might not work for most men based on how effective it is in lowering DHT. But you don't actually know if you're actually taking enough to have a benefit. You just kind of have to take their word for it because they don't tell you. I don't like that. And this other huge ingredients list, most of these supplements have only very weak evidence at best, or could benefit hair loss but only if you have a deficiency. For example, this biotin thing that everyone always talks about, like, oh, biotin's great for hair loss, hair, skin, and nails. It's only beneficial if you have a biotin deficiency. And most people in most Western countries do not have a biotin deficiency. It's a very commonly available nutrient that you can easily get from your diet. Potentially, these ingredients could have some, let's say, weak to moderate evidence at best for improving hair loss. But, I wouldn't bet your hair on this, at least based on the ingredients alone, unless you fall into that very small group of men who might have a nutrient deficiency or is a hyper responder to saw palmetto or ashwagandha, right? And then also this result in 6 months or your money back guarantee. You look here in the terms and conditions, you have to follow like all these criteria in order to get your 6-month guarantee. And they're going to run your photos that you have to take through an AI photo analysis. And the AI is going to determine whether or not your hair grew or regrew. And then it's going to determine whether or not you qualify for this refund. I don't know how you feel about that. I'll leave that up to you. It doesn't make me feel great that a photo is going to be evaluated by a random AI model that Nutrafol developed, and they're going to determine whether or not it worked for you. So in closing, what's the summary and takeaway? Nutrafol has some pretty strong claims for hair regrowth, right? And they push this like, hey, it's all natural supplements and it doesn't affect your libido and it's very effective, right? All these things that target your fears, but you really have to look at the evidence and look at the studies. What does it actually show? And then you also have to move away from this naturalistic fallacy, meaning just because something is natural doesn't necessarily mean that it will be effective or ineffective. And it doesn't necessarily mean that it will be safe or unsafe. Supplements, in my opinion, can be just as effective as certain medications, but they also have side effects, just like any other medication. They're not all benign or totally harmless, and nor are they worthless. It really depends on the supplement, right? You have to look at the science to really determine what's going on, and not just listen to these appeal to your fears, your anxieties, and your emotions. I would give Nutrafol, unfortunately, maybe a like D, C minus at best for its efficacy. I don't think it's going to harm somebody from taking it. You might have some benefit, right? Maybe you have a nutrient deficiency you didn't know about. Maybe some of those stress lowering ingredients could be beneficial to you. And if stress was a factor in your hair loss, this could be a good thing to add. I don't really have any issues with it as being harmful, but as far as being super effective for your hair loss, I don't think so. I think it could be a reasonable stepping stone or an adjunct to other treatments that you're trying, right? Maybe you can give this a shot for a couple of months before you decide to try out the medications. There's nothing wrong with that. But, just take their lofty claims with a grain of salt. If you've enjoyed this reaction video, I would appreciate a like and a subscribe. It really does help me out a lot. Once again, this is Kevin from Crowncraft. See you later. Bye.